The veterinary technology program here at Ridgewater College has been here since the early 90s. We're really proud of our history. The program originally, its predecessor program, was at the University of Minnesota at the Waseca campus. Waseca is down the other side down near Mankato. And in the early 90s, the legislature made a decision to close that campus and turn it into a women's prison. And it was a beautiful agricultural campus, but the program then at that time, this is again early 90s, moved here to Willmar, Minnesota, to Ridgewater College, and has been here since the early 90s. Veterinary technology is a really cool profession. The veterinary technician is sort of a combination of that human nurse and the medical technologist, so they're helping the veterinarian to provide services as part of a team of delivery. Veterinarians and veterinary medicine is advanced to the point where we really need the team to be able to do a good job for people and their pets, their animals. To get into veterinary technology, we do have some entry requirements. We have the reputation of having a good program. We're very proud of that. It's important, though, that prospective students understand what they might get into here. We require that students have to have had at least high school level chemistry, high school level biology, a year of each of those, and it has to be at a C level or C grade level or better, or a student can have a college equivalent of those courses if they have not had those in high school. When I talk about veterinary technology, I think it's always important to appreciate that I say there's three things you need to be successful as a veterinary technician. And first and what foremost attracts people to this profession is that they love animals, and that's great. But they also have to love and be intrigued by science, and they've got to love and be intrigued by medicine. If somebody comes to this program and says, I didn't know I had to handle blood, I didn't know I had to clean up dog poop, I didn't know I had to do some of these things, this might not be the profession for them. Yes, we all need to love the animals, but it's also got to be those other challenges. This morning I'm going to be working with the students in the surgical nursing and anesthesia laboratory group. I'm the veterinarian, so I'm the one going to be doing the surgery, but the students have to do the anesthesia. The veterinary technician's responsibilities in a veterinary clinic would be to assist with surgery, prepare the patient, and the key one is keeping that patient alive, doing the patient anesthesia. So the students today are going to be doing all the steps with our guidance. I'm assisted in my lab by a certified veterinary technician laboratory assistant. And Julie's been with me for a very, very long time, many, many years. We work well as a team to help the students learn. Students are going to be examining the patient. The patient today is a 1-year-old Labrador Retriever named Violet. Violet is owned by one of my friends and neighbors, known him a long, long time. Most of our surgeries are done on patients that we would get from the Humane Society. So the students will be doing a physical exam on Violet to make sure she's okay. Violet was here 2 weeks ago, had her weight taken, had a physical exam, and had some pre-surgical blood work to make sure that everything was okay, and her blood work all looked perfect. So she's here this morning just to make sure that her temperature and her heart and everything is normal. Then the students will administer some pre-anesthetic drugs. We're going to be giving her a drug to stabilize her heart rate. We're going to be giving a tranquilizer just to make it a little easier for Violet and for the students. And we're going to be giving her a medication that will provide her with some pain relief because we want her to be comfortable during surgery. We'll give that about 30 minutes, and during that 30 minutes I review with the students the drugs that we're using today. It's a good opportunity because, of course, they're just learning. This is only our second week of surgery with this group of students. This is a very competent lab group, but we want to review the drugs and what is going to happen today. Then we'll get Violet out and we're going to put one of the students will be putting an intravenous catheter into Violet's leg, front leg. We need that catheter in place to administer the induction anesthetic drugs that we'll be using to make her sleepy for her surgery. And we always want to have a catheter in the patient in case there'd be any bleeding or we'd need to administer any additional drugs intravenously. Once we've got the catheter in place, we'll induce anesthesia. We're going to use a drug that's used in human medicine called propofol, very, very common anesthetic agent. It's used in many, many species. The beauty of propofol, it's a very safe drug. Once Violet is sleepy from that, she'll have a tube put into her trachea. It's called an endotracheal tube. and then her anesthesia will be maintained with gas anesthesia using sevoflurane. Surgery is expected to be a routine ovariohysterectomy or spay. Like I say, Violet's 12 months old, 11, 12 months old, so it's a perfect time to have her spay surgery done. Violet will be put on a monitor that's really cool. It's the same sort of an anesthesia monitor that is used on humans. So it's a monitor in which she has a number of things attached to her body so that we can be checking her electrocardiogram, EKG. We can be checking the amount of oxygen dissolved in her bloodstream. That's called oximetry. She has a little lead put on her tongue. Human medicine, they put it on your finger or on your thumb. And in animals that are anesthetized, we put it on their tongue. It seems to work a little better. She'll have an attachment to her endotracheal tube where every breath, we'll be measuring the amount of exhaled carbon dioxide. We'll be measuring her heart rate, pulse rate, blood pressure will be measured, and also her internal body temperature. So all those things are measured during anesthesia.